open your mouth right now and run your tongue slowly along your gum line. Is there a spot that feels tender? A place where your gum has pulled back from a tooth more than it used to? A faint, metallic taste of blood that you have learned to ignore over the years. If any of that sounds familiar, I need you to keep watching, because what you may have been treating as a minor dental annoyance, something you might casually mention at your next dental cleaning, may be doing something to your brain that nobody in your dental chair has ever explained to you. In the past decade, peer-reviewed research has confirmed something that 20 years ago would have sounded almost outlandish. Specific oral bacteria, the same ones involved in common gum disease, have been found inside the brains of patients who died with Alzheimer's, not nearby, inside. And the molecular trail those bacteria leave behind has been linked to the formation of the same plaques that characterize cognitive decline. This means that what is happening in your mouth right now is not separate from what is happening in your memory 10 years from now. They are connected by a biological pathway that we are only beginning to understand. There are 3 specific dental situations where the right decision protects your brain and the wrong decision quietly accelerates damage. They are not what most online content tells you they are. In fact, 2 of the 3 are situations where avoiding treatment is far more dangerous than getting it done. My name is Dr. Marcus Reeve. I spent 20 years as a neurosurgeon before turning my focus to health education and medical research. I operated on brains affected by exactly the inflammatory mechanisms we are about to discuss. I have seen what chronic inflammation does to small vessels, to neural tissue, to the integrity of the blood-brain barrier, and the trail, more often than people realize, led back to the mouth. A quick brief note before I start. Everything in this video is general health education grounded in peer-reviewed research. It is not personalized medical advice and cannot replace a conversation with your own dentist and physician. If you have a dental infection or any acute problem, please do not delay care based on a video. Untreated dental infection is far more dangerous than properly treated dental work. If this is the kind of honest, science-based conversation you have been looking for, type yes in the comments. It helps this video reach others who deserve to understand what their mouth is telling them. Now let's start. To understand how a problem in your mouth can affect your brain, you need to understand something about how those 2 parts of your body are actually connected. They are not separate compartments. They share blood vessels, nerves, and immune pathways that operate continuously every single day of your life. Your mouth is one of the most bacterially active environments in your entire body. It is home to hundreds of species of microorganisms, most of them harmless, many of them genuinely helpful. A healthy mouth maintains a balanced ecosystem the way a healthy gut does. The problem begins when that ecosystem tips out of balance, when certain aggressive species multiply unchecked, and when the tissue lining your gums becomes chronically inflamed. That inflammation is the key. When the lining of your gums is inflamed for years, it stops functioning as a sealed barrier. Microscopic gaps appear between the cells. Bacteria, bacterial fragments, and inflammatory molecules slip from your mouth into your bloodstream every time you chew, brush, or even speak. This is not theoretical. It has been measured. People with significant gum disease show meaningfully higher levels of oral bacteria in their blood throughout the day, Once those bacteria reach the bloodstream, several things can happen. They can settle in the lining of blood vessels, contributing to inflammation throughout the body. They can travel to distant organs, and in certain cases, they can cross or weaken the blood-brain barrier, the protective membrane that normally keeps unwanted substances out of brain tissue. I want to pause on the blood-brain barrier for a moment because when I was operating, this structure was something I worked with every day. It is one of the most elegant systems in human biology, a network of tightly joined cells lining the small vessels of the brain, allowing only carefully selected molecules to pass through. Almost everything else is held back, but the blood-brain barrier is not invincible. Chronic systemic inflammation, the kind produced by a long-standing gum disease, gradually weakens the tight junctions that hold those cells together. Substances that should never reach brain tissue begin to slip through, and the brain's own immune cells respond by mounting an inflammatory response inside the brain itself. Sustained over years, that response is one of the mechanisms researchers now believe contributes to accelerated cognitive aging. The mouth is not separate from the brain. It never was. We were taught to treat them as different territories because medicine and dentistry have been historically siloed. The biology does not respect that silo. Before we get into the three specific situations, I need to draw a clear line. If you have a tooth that is throbbing constantly, a visible swelling on your face or jaw, fever combined with mouth pain, or pus discharging from a gum, you have an acute dental infection that requires same week, sometimes same day, treatment by a dentist. Do not manage that with a video. An untreated dental abscess is one of the most dangerous oral conditions there is. If you have bleeding gums that have been bleeding for months, persistent bad breath that does not respond to brushing, loose teeth in adulthood, or gums that have noticeably pulled back from your teeth, you likely have moderate to advanced periodontitis. That needs professional evaluation, not avoidance. The mistake to avoid is the opposite of what some online content suggests. The real danger to your brain is not properly performed dental treatment. The real danger is untreated chronic infection, neglected gum disease, and the slow, silent inflammatory load they create over years. With that clear, let's look at the three situations that matter most. The first, and by far the most important situation, involves the most common, the most underestimated, and the most underdiscussed condition in the entire field of senior dental health. Chronic gum disease, periodontitis. By the age of 65, the majority of adults have some form of periodontitis. Most do not know it. It is largely painless until it becomes severe. It progresses slowly over years, and most people only notice when teeth begin to loosen or when a dentist finally measures the pockets between gum and tooth and finds them deeper than they should be. Here is what makes periodontitis specifically dangerous for the brain. In 2019, a research team published a landmark study in the journal Science Advances. They examined brain tissue from patients with Alzheimer's disease and found inside that tissue the presence of a bacterium called Porphyromonas gingivalis. This is one of the primary bacterial drivers of periodontitis, not nearby in the bloodstream, inside the brain. They also found enzymes called gingipains, produced exclusively by this bacterium in higher concentrations in patients with cognitive decline. The implications of that study reshaped how we understand the connection between oral and brain health. A study published in the Journal of Alzheimer's Disease in 2020 found that adults with severe periodontitis had a meaningfully elevated risk of developing dementia compared to adults with healthy gums. A large Korean cohort study following more than 250,000 adults found a similar association. The mechanism is what we discussed earlier. Chronic gum inflammation allows bacteria and their byproducts to enter the bloodstream continuously. Over decades, this contributes to weakening of the blood-brain barrier and to chronic neuroinflammation. What this means in practical terms is that if you have untreated periodontitis right now, the most cognitively protective action you can take is to address it, not avoid the dentist, the opposite. I want to be very clear here because some content online frames deep cleaning as dangerous. The actual research suggests the opposite. Untreated periodontitis is the inflammatory threat. Properly performed periodontal treatment reduces that threat. Multiple studies have shown that treating periodontitis lowers systemic inflammatory markers, including C-reactive protein, within months. Lower systemic inflammation means less pressure on the blood-brain barrier, less neuroinflammation, and a healthier environment for the brain to age in. If your gums bleed when you brush, if your dentist has mentioned pockets, if it has been more than a year since your last cleaning, this is the conversation to have at your next appointment, not because of fear, because the science genuinely supports it. If you find this useful, a quick like helps this video reach others who might have dismissed bleeding gums. No pressure, just appreciated. Amalgam that many adults over 60 still have in their molars. These fillings contain a mixture of metals including silver, tin, copper, and approximately 50% mercury by weight. This topic has been the subject of considerable confusion, and I want to give you the honest scientific picture rather than the alarming version or the dismissive version. Here is what the actual research and the position of major regulatory bodies, including the FDA, the World Health Organization, and the American Dental Association currently say. Intact, stable amalgam fillings that have been in place for many years are generally considered safe for the vast majority of adults. They do release very small amounts of mercury vapor, but at levels considered to be below the threshold of toxicity for most people. Removing healthy, intact amalgam fillings simply because they contain mercury is not recommended, because the removal process itself produces significantly more mercury vapor exposure than leaving them undisturbed. Read that again, because it is important. If you have old silver fillings that are not broken, not leaking, and not causing problems, the act of removing them carries more risk than leaving them in place, unless that removal is done with very specific protective protocols. Where the situation does become more nuanced is in two specific scenarios. The first is when an amalgam filling has cracked, fractured, or begun to deteriorate. At that point, it needs to be replaced because the underlying tooth is no longer protected. And when that replacement happens, how it is done matters enormously. The second is for adults who already have certain conditions that may increase sensitivity, including significant kidney disease, neurological conditions, or known heavy metal sensitivities. For these patients, a conversation with both dentist and physician about timing and protocol is appropriate. In both cases, what you want to ask about is something called the SMART protocol, which stands for Safe Mercury Amalgam Removal Technique. It includes high-volume suction to capture vapor at the source, a rubber dental dam to prevent fragments from entering the digestive system, additional oxygen supplied through a nasal cannula, and proper protective equipment. The practical takeaway is this: do not remove healthy old fillings solely due to a vague mercury concern. Do, however, insist on a careful removal protocol if any filling needs to come out for legitimate reasons. And avoid having new amalgam fillings placed when alternative materials like composite resins or ceramics are available and appropriate. This is the kind of nuanced conversation that gets lost when content is framed as all amalgam is poison or all amalgam is perfectly fine. Neither extreme captures the actual science. The reality sits in the middle, and the middle is the part that protects you. The third situation is the one that most surprises people when I explain it, because it runs counter to a popular online narrative. The biggest dental threat to your brain is not getting a procedure done. It is failing to get a procedure done. Specifically, leaving an infected tooth in your mouth out of fear of treatment, losing teeth and not replacing or restoring chewing function, ignoring abscesses or persistent dental pain. Each of these creates a sustained inflammatory load that does measurable damage over time. Let me explain the mechanism, because once you see it, the logic becomes obvious. When a tooth becomes deeply infected and goes untreated, the bacteria do not stay confined to the tooth. They seed the surrounding bone, the bloodstream, and through certain anatomical pathways can reach other parts of the body. One particular pathway worth understanding involves the trigeminal nerve, the large nerve that carries sensation from your face and mouth into your brain. It has direct connections to deep brain structures, including areas involved in memory. Researchers have documented that certain oral bacteria can travel along nerve pathways, including the trigeminal nerve, in a phenomenon called retrograde axonal transport. This is one of the proposed routes by which oral pathogens may reach brain tissue. The evidence is strongest for chronic, untreated infection rather than for properly treated teeth. Properly performed root canal therapy, despite the noise around it online, is supported by decades of evidence and is recognized by the American Association of Endodontists as a safe, effective treatment that removes the infected tissue from inside the tooth and seals it. Comprehensive reviews have failed to find credible evidence that properly performed root canals cause systemic disease. The original claims that they did were based on research from the 1920s that has been thoroughly re-examined and is no longer supported by modern microbiology. What is supported is the opposite. A tooth with significant infection that is left untreated continues to produce inflammation for years. A root canal that resolves that infection removes the inflammatory source. There is a second piece of this that almost nobody talks about. Tooth loss itself, when teeth are missing and chewing function is significantly reduced, has been linked in multiple studies to accelerated cognitive decline. Research from Japan, including large cohort studies, has consistently found that older adults with fewer remaining teeth show higher rates of cognitive impairment. The proposed mechanisms include reduced blood flow to brain regions stimulated by chewing, altered nutrition due to dietary changes when chewing becomes difficult, and the sustained inflammation that often accompanies the underlying tooth loss. This is why proper dental restoration, whether through implants, bridges, or well-fitted dentures, is not cosmetic. It is functional, and the function it preserves is connected to brain health. The honest message here is the opposite of what some content suggests. Do not avoid necessary dental work out of fear of the procedure. Do find a dentist whose approach is thorough, whose hygiene protocols are strong, and whose communication is clear. The risk of carefully performed dental treatment is far lower than the risk of leaving infection or tooth loss unaddressed. Consider someone I will call Margaret. She is my friend's mother from the university. She is a composite, built from many patients and conversations over the years rather than a single individual. Margaret was 71. Her gums had been bleeding mildly when she brushed for several years. She had been told it was nothing serious, that her gums were just sensitive. She had stopped bringing it up. She had also lost 2 molars over the previous decade and never replaced them, because she could chew well enough on the other side and had been worried about the cost and effort of restoration. What nobody had measured was her overall inflammatory load. When her primary care physician finally ran a C-reactive protein test for an unrelated reason, the result came back meaningfully elevated. Her physician asked about her gums. Margaret mentioned the long-standing mild bleeding, almost as an aside. She was referred to a periodontist. The evaluation showed moderate periodontitis with deeper than normal pockets around several teeth. She underwent scaling and root planing in 2 sessions, began using a gentle interdental cleaner daily, and had her remaining gaps assessed for restoration. 4 months later, her C-reactive protein had dropped substantially. Her sleep had improved. Her sister, who saw her every Sunday, said she seemed sharper, less fatigued in the afternoons. She had not changed any medication. She had not changed her diet dramatically. She had treated the chronic low-grade inflammation that had been quietly running in the background of her life for years. Now, I will give you some practical framework. First, treat your dental cleanings as part of your brain health protocol, twice a year at minimum. If you have any signs of gum disease, more often as your dentist recommends. This is not cosmetic. It is one of the most evidence-supported things you can do to reduce systemic inflammation. Second, ask your dentist directly about the depth of your gum pockets. This is a measurement they take during cleanings. Anything consistently above 3 millimeters warrants a conversation about what to do. If they have not measured recently, ask them to. Third, if you need amalgam fillings replaced for legitimate reasons, ask specifically about the SMART protocol. A good dentist will either follow this protocol or refer you to someone who does. Fourth, do not leave infections or significant decay untreated. The fear of procedures is, in this case, a far greater risk to your brain than the procedures themselves. Properly performed dental work is protective. Fifth, if you have lost teeth, have a real conversation about restoration, not for appearance. For function, chewing on a full set of teeth or well-fitted prosthetics keeps blood flowing to brain regions that depend on that stimulation, and it keeps your diet diverse enough to maintain nutritional balance. Sixth, consider whether you want to seek out a dental practice that takes a more integrative approach. These practices vary in quality and philosophy, and not all of their claims are equally supported by evidence. Choose carefully. Look for dentists whose training is mainstream and whose additional approach is added on top of, not in place of, standard evidence-based dentistry. At home, your daily practice matters more than any procedure. Brush twice daily with gentle pressure. Clean between your teeth with floss, interdental brushes, or a water flosser every single day without exception. The bacteria living between your teeth are the same ones contributing to the inflammatory load we have been discussing. First, schedule a dental cleaning if you have not had one in the past 6 months. If you have, ask at your next appointment about your pocket depths and your gum health specifically. Second, this evening, when you brush, pay close attention. Notice any spots that bleed, any tenderness, any areas where your gum has receded. Write them down. Bring that list to your next appointment. Third, evaluate your home care honestly. Are you cleaning between your teeth every single day? If not, this is the single most impactful change you can make at home this week. Pick a method and commit to it nightly. Fourth, if you have an old amalgam filling that is cracked, leaking, or causing sensitivity, schedule an evaluation. Ask about replacement protocols before the appointment, not during it. Fifth, if you have been avoiding a needed dental procedure out of fear, this is the week to call. The longer you wait, the more inflammation accumulates. What I learned in 20 years of operating on the brain is that the body does not have neat boundaries. The systems we treat as separate, the heart and the brain, the mouth and the memory, are connected by biological pathways that operate continuously every day, whether we pay attention to them or not. Your mouth is one of the most important upstream inputs to your brain's inflammatory environment. The good news is that of all the factors that contribute to cognitive aging, your oral health is among the most directly within your control. You can brush. You can clean between your teeth. You can attend regular cleanings. You can address infection and gum disease before they become silent contributors to a process you do not want to accelerate. The message of this video is not to fear your dentist. It is the opposite. Find a thoughtful dentist, build a real relationship with them, and treat your oral health the way you would treat your cardiovascular health. As something connected to everything else, your mouth has been speaking for years. Now, you know how to listen. One last question before we close. How old are you, and where are you watching from? Write it in the comments. The dental and cognitive patterns shift across decades, and knowing the age of this audience helps me shape what I cover next. A quick, brief reminder, everything in this video is general health education, not personalized medical advice. Your individual situation should always be evaluated by your own dentist and physician. If this helped you, please share it with someone whose gums you have noticed bleeding, or someone who has been quietly avoiding the dentist for years. You may be giving them the explanation that finally moves them to act. Take good care of yourself. I will see you in the next video.